Hi, I'm Ben Elder. I'm starting my fourth year here in the faculty in the department at Mayo Clinic. Uh, I originally grew up in Cleveland, Ohio, and then joined the MD PhD program at Baylor College of Medicine as well as Rice University, and then pursued my residency training at Johns Hopkins before I ended up back at Mayo. My practice focuses predominantly on spine, specifically looking at adult spinal deformity, as well as complex spine surgery. I also have a side interest in normal pressure hydrocephalus, which is kind of an odd juxtaposition between the two fields. But I got interested in that field during residency and have continued to build the practice here. I also have a fairly active research component, both basic science as well as clinical research. In the lab, I work on tissue engineering of bone and cartilage. In terms of some of the bone projects, we're looking at developing new polymers for injectable and moldable scaffolds for bone replacement. This would allow for more minimally invasive approaches, both for replacing corpectomy defects as well as potentially injecting bone material into the disc space rather than needing to use a cage. Additionally, we're looking at regenerating facet cartilage and SI joint cartilage. We have a scaffoldless approach in which chondrocytes are put together and actually will form new cartilage tissue. And then we're looking at creating molds and looking at different ways to integrate that with the facet joint, and then potentially looking at SI joint cartilage replacement in the future as well. On the clinical side, we also have multiple projects, both within areas of spine research as well as normal pressure hydrocephalus. In terms of spine projects, my main interest is in looking at the effects of osteoporosis on outcomes of spine surgery, as well as figuring out better ways to diagnose osteoporosis in spine patients, and specifically looking at bone density within the spine, since most measures of bone density are done outside of the spine when we do preoperative assessments. Also, we're looking at the effects of some of the newer drug therapies on bone density, as well as improving fixation and leading to better fusion outcomes. Some other areas we're actively engaged in are looking at the degree of SI joint motion in both healthy and degenerated joints. And we're also involved in a multi-institutional study exploring the benefit of performing an SI joint fusion at the same time of long segment fixation to the pelvis with S2 iliac screws. In terms of hydrocephalus research, we have an active prospective registry in addition to the Mayo registry of patients that have been shunted for normal pressure hydrocephalus. We're also very fortunate to have a complex motion analysis lab here at Mayo where we can do very intensive assessments of gait changes. This has allowed us to quantify more of the specifics of how patients with NPH's gait is affected, as well as potentially yield better diagnostic tests and ways to separate it from other neurodegenerative diseases. Additionally, we just completed a study looking at some high-tech accelerometers and being able to track patients' recovery in the outpatient setting, where we can mail them these accelerometers to see how their gait is doing, so we get a much more objective measurement without them having to actually come back to Mayo. Last, we were looking at the risk of glaucoma in patients who have been shunted for normal pressure hydrocephalus. I think Mayo has a fantastic residency program here. I was actually a sub-intern here back during med school in the late 2000s and really enjoyed my time here. And because I liked it so much, I ended up coming back here on faculty. I think some of the highlights of Mayo's residency program are the mentorship model, in which you get time to spend very closely with the different faculty over a couple of months. And I think this gives you a much better experience than working with a faculty member every now and then. Additionally, there's 2 years of protected time for research, although I think there is an advantage that there is still some call that happens on the weekends. And this allows you to be actively engaged, but on a fairly limited basis during your research time. So you're not coming back into things after 2 years. It allows you to stay fairly fresh with your clinical skills. Also, there's numerous research opportunities available in the department, both with the clinical research as well as multiple basic science labs with NIH funding, even within our department. Also, I think there's fantastic early and very closely mentored clinical experience. And I think our PGY2s by the end of the year are very capable of doing basic cases with supervision, but really acting as a primary surgeon during these cases, which I think is very unique to our program. I think Rochester is definitely not a big city, but I think there's lots of activities to do. My time is spent with my 3 kids. In the past, I was a swimmer in college and have done a number of triathlons, and I'm trying to get back into that more. Additionally, I play several music instruments, but I'm mostly involved with helping my kids and with their music and athletic endeavors. I think there's lots of outdoor activities to do in Rochester. The winters do get pretty cold, but we do have decent Midwestern skiing within about 45 minutes to an hour of here. So that's usually a good escape for the weekends. Lots of other people do cross-country skiing or snowshoeing, and then in the summer, there's probably not many better places to be if you like outdoor activities. There's fantastic hiking, canoeing, kayaking, as well as cycling with long rolling hills and farmland without much traffic. So it's really a great place to be outdoors, especially in the summer. All in all, I think this is one of the best residency programs in the country, and I look forward to meeting more of you in the future.